This is an article that is in press. But it's online in the Journal of Adolescent Health. And what the investigators did was they reviewed prescriptions from drug plans that documented how many teenagers between the ages of 13 and 17 were prescribed opioid drugs for headache relief. And these are drugs such as Vicodin or OxyContin, and they have a high degree of danger of addiction and abuse. So it's somewhat concerning. And they actually examined the records from 2007 and 2008 of 8,400 teenagers. And they found that of these teenagers, nearly half of them, 46%, received at least one prescription for an opioid drug for headache. And 23% of the adolescents got two prescriptions, and 29% actually received three or more prescriptions for headache. So this is of concern because overdose deaths from prescription medications have been growing by leaps and bounds. The number of overdose deaths from prescription drugs have skyrocketed since 2000, between 2000 and 2012, by over 200%. So this is really a matter of some concern. Now, not all these overdose deaths, of course, were due to teenagers getting these drugs for headaches, but it's still a matter of great concern whether or not the teens themselves are becoming addicted or dependent on these drugs, whether they're abusing the drugs, whether they're sharing them with friends. It's still a serious issue. And so what we suggest is that physicians who have been prescribing these drugs need to perhaps step back a bit and consider whether the teens could or should be getting some other drugs rather than these opioid drugs that can be so easily abused or overused.